Good afternoon and welcome to our show, Health and Wellness Myths versus Facts. The definition of health now goes far beyond just the absence of disease. The COVID pandemic has put mental as well as physical health and wellness into very sharp focus indeed. What are we talking about? Well, the awareness of disease and the awareness of symptoms, of course, is essential now for screening and early detection, particularly when it comes to chronic illnesses. Many of them are now showing up far more after patients have already recovered from COVID. Well, if people are aware of diseases and its symptoms, they're far more likely to take action to prevent them from happening. Go to healthcare providers for checkups. We're talking particularly about chronic conditions like diabetes and heart disease, which come with complications as well. It's essential really to identify symptoms early and take corrective steps, and expert advice is always of a great deal of help in situations like that. Expert advice rather than reliance on social media. Well, as always, we're joined by medical experts on the show. Dr. P. Naveenkumar, MD, physician and diabetologist with the APN Clinic and Diabetic Center, is with us, as is Dr. Girish Navasundi, MBBS, MD, DNB Cardiology. He's a cardiologist with the Apollo Hospital. Thanks very much indeed, both of you. Dr. Naveenkumar, let me begin with you. Now, awareness about metabolic disorders is clearly increasing, but people still perhaps don't know the exact warning signs that they would be watching out for that could indicate the presence of diabetes. Is there a sort of list of common symptoms that you could tell us about? And, should diabetes testing, even if there are no symptoms, be made mandatory after a certain age? What are your recommendations?
Type 2 diabetes patient usually presented with increased urine output, especially during night times. They can also have increased in their thirst, and they can have an increase in appetite. These are the usual symptoms, and also they can present to you with like weight loss, unusual tiredness. They can have a pain and burning sensation in their feet, and they can also present with increased incidence of infections, especially in the genitourinary system. These are the common symptoms we used to get from the patients. And about the screening in asymptomatic patients, of late we are seeing more and more younger patients with the type 2 diabetes. Even if you have risk factors or family history or not, it's better to check your blood sugar level at the age of 20. If you don't have any risk factors or family history, you can check once in 5 years until the age of 40. But you have risk factors like obesity, stressful life, sedentary lifestyle, and family history. It's better to check once in 2 years. Once you cross 40 years, it's better to check once in a year.
Right.
That's the way we used to screen.
Okay. Dr. Navasundi, we've heard about rather famous cases in recent weeks and months where young and extremely fit people have actually died because of a heart attack or a cardiac arrest. Now, is there a difference between the two terms? And, are there any warning signs, or, by their very nature, are they sudden?
Yeah, that's a good question, Ankita. The heart attack and cardiac arrest are two different. Heart attack when the blood supply to the heart muscle is significantly reduced by preventing oxygen supply, the heart will die. That's called heart attack. Cardiac arrest, when the electrical activity of the heart is deranged, the heart completely stops, or it stops even too rapidly, preventing sufficient oxygen supply to the brain. The commonest cardiac arrest in about 80% of the time, it's the heart attack with cardiac arrest. Coming to the question of having cardiac arrest, very fit does not mean very healthy. So it's very important to know the distinction that those who are very fit can also have underlying illnesses which were undiagnosed and suddenly can manifest in terms of great damage in terms of heart attack, rarely in cardiac death. So those who actually pursue intense activity better to have their health checked, work on this kind of.
Right. Dr. Naveenkumar, let's talk about diabetes and particularly type 2 diabetes. Some articles claim that, there are ways to reverse diabetes. Is that possible? And if yes, is there a time frame? What do your patients ask you about this? And, what's your response?
Yeah, definitely. You can reverse the type 2 diabetes, especially if they are in the pre-diabetic state. That is, they have a higher blood sugar than the normal, but they cannot label as a diabetes, not in such a high amount to label as them as type 2 diabetes. And younger patient with the newly detected diabetes, these are the candidates for reversal of diabetes. Methods we used to follow for reversal of diabetes are low carbohydrate diets like paleo, keto, and other methods like intermittent fasting. When these diet methods were complemented with the physical activities like exercise and yoga, you can reverse the diabetes. And in morbidly obese patients, those who have a BMI more than 40, when they undergo bariatric surgery, they can reverse the diabetes in them. And answering the second part of your question, the duration, it's a bit tricky. You cannot exactly say the time frame for a reversal. Those who have a pre-diabetes will reverse fast when compared to a established diabetic patient, and younger and newly detected diabetic patient will reverse faster than an older and prolonged disease. So we cannot pinpoint the exact duration.
Right. So, Dr. Naveenkumar, let me ask you this. Diabetes generally comes with other comorbid conditions. Hypertension is one of them. Is there a sort of two-way link between the two? How does hypertension affect diabetes?
Yeah, both hypertension and diabetes share the same common pathogenic mechanism. But when a patient with the type 2 diabetes, when he has a continuous blood pressure of more than 140 over 90 millimeter of mercury, what we call as hypertension, it will accelerate the complications of diabetes like stroke, incidence of heart attack, cardiac failure, even kidney failure, and vision loss secondary to retinopathies. These are the complications of diabetes will be accelerated by when the uncontrolled blood pressure of the patient. And once the patient has a diabetes, his blood pressure should be maintained well below 130 over 85 millimeter of mercury.
Right. We will take a very quick break at this point, but be back with our experts with lots more questions. Stay tuned. Welcome back. You're with Health and Wellness Myths versus Facts, where we take a closer look at chronic illnesses and how you can protect yourselves. As always, we have medical experts with us. Let's go right back to Dr. Girish Navasundi, who's back with us. Dr. Navasundi, who's at higher risk of cardiac arrest? And, can anything be done to reduce this risk? Does a sudden cardiac arrest affect only the elderly? Because we seem to be hearing more instances of younger people falling prey to them too.
What we need to understand is any adult is at risk of sudden cardiac death. In the highest number of people who die of natural cause, the cause of death is sudden cardiac death. Not everybody is at risk, but those who have multiple risk factors, such as those who have high blood pressure, diabetes, kidney disease, smokers, obese people, who have sleep apnea, these are the people who are at higher risk. More than that, the ones who have already had a heart attack in the past or any sort of heart disease in the past or whose heart has been weaker in the past, these are the subset of people who are at a higher risk of heart attack. Now, and sudden cardiac death. How do we reduce the risk of sudden cardiac death? The most important thing is the screening. You need to look at the vulnerable population and invest time and energy to screen them to prevent a sudden cardiac death. Do they have a symptom that can predict that these people can have sudden cardiac death in the future? Yes. those who have had discomfort in the chest, those who have had swelling of feet, those who have significant breathing difficulty on exertion, or those who have had giddiness or short, brief loss of consciousness, these are the people who are vulnerable. So if these people seek medical counseling or an opinion in terms of doing certain blood tests and basic cardiac evaluation with tests like an ECG, echocardiogram, and a treadmill, can detect and understand their own prediction for future cardiac arrest, and we can save many lives.
Right. You talk about saving lives, and sometimes sort of resuscitation can actually help those with can help people survive a sudden cardiac arrest, but will they be necessarily able to resume a normal life? Do they experience any complications? What are your thoughts on that, Dr. Navasundi?
See, I think the greatest service one can do to humanity is to save a life when there is a sudden cardiac arrest. Yes. Even uneducated workers in a mining trench, when they go down, they're able to save a life because they're trained. But unfortunately, so-called many learned individuals who work in great offices do not have a skill set to support a life until emergency medical care arrives. So my sincere request to people is to train yourself to do a basic cardiopulmonary resuscitation and hold on to the life till emergency services arrive. Coming to the next question, what happens if there's a cardiac arrest? It's such an it's such an unforgiving condition that about 90% do not survive the sudden cardiac arrest. The greatest chance of survival depends on the bystander who can do some amount of cardiopulmonary resuscitation. And those 10 to 20% who survive the sudden cardiac arrest have a great quality of life, provided quickly they are brought into a medical facility and the cause of sudden cardiac arrest is treated and the heart function is improved by proper medical or surgical therapy, followed by a good rehab that can happen. It takes usually 3 to 12 months to go back to their full normal self.
Dr. Naveenkumar, how would you recommend a person with diabetes cope with stress, specifically in living with his condition? Because diabetes automatically does mean lots of checks, lots of sort of dietary restrictions, many things that one has to keep in mind. So would you say that that is an additional contributor to one's stress levels, and then how do you deal with that?
Yeah, definitely. This is the least addressed aspect in diabetic care management, because we used to talk about drugs, insulins, lifestyle modification, even about bariatric surgeries. But this psychological aspect of chronic disease, as you mentioned about the lot of tests, prescriptions, and knowing about the complications which arises in the future, it puts the patient under a great psychological stress. It can manifest as anxiety, depression, and sometimes patients land up in a severe kind of depression, which will lead on to the improper following up of medications. So the identification of this kind of patients and proper counseling by the care provider and support from the family and peers and friends, this is the most important thing to cope up with this kind of psychological distress in patients with type 2 diabetes. And also practices like exercises, yoga, and meditation, they are known to improve the mood. They are also helpful in alleviate the psychological distress secondary to this type 2 diabetes, which is a chronic disease.
Dr. Navasundi, now this might sound like a somewhat flippant question, but sometimes, symptoms of heartburn can really mimic symptoms of a heart attack. How is there a way of being able to distinguish between the two? Because, you'd presumably go into all sorts of sort of management sort of ways. If it indeed were a heart attack, you'd be sort of rushed to a hospital, you'd want to undergo testing, perhaps an angioplasty. So, how do you distinguish between the two? Is there any way of knowing which is a heart attack and which is not?
Right. To laymen, what I would like to communicate is, please do not self-diagnose please take the advice of an expert whenever there is a discomfort which is significant. But in general, if you have to make a distinction between chest burning because of acidity or acid peptic disease, what we call gastritis, versus a heart-related chest pain, the discomfort in case of indigestion or acidity is usually burning or bloating that happens in the abdomen and usually related to food. On the contrary, the chest discomfort that happens during a heart disease or a heart attack is usually a sense of heaviness, tightness, squeezing, or a burning that can extend anywhere all over the chest, going up to the shoulders or the arms or up to the jaw. And this discomfort persists for at least 5 to 10 minutes and tend to worsen on exertion, walking, climbing, or it tends to reduce when one rests. Secondly, these also can be associated with sense of unwellness. That means they would feel shortness of breath, excessive tiredness, sweating, and basically a sense of being very unwell, which is not usually associated with gastritis. And thirdly, if any discomfort that is manifested in those people who have underlying risk factors such as hypertension, diabetes, previous heart disease, kidney disease, obese, or more than anything else, young people who have had a family history of heart disease, these individuals should not underestimate the discomfort, although probability of heart disease could be less, but that needs to be ruled out first before you treat for acid peptic disease.
Okay. Thank you. That was a very clear explanation. Dr. Naveenkumar, after targeted, are the targeted glucose levels for diabetes management different for different age groups? Does the presence of diabetes complications, other comorbidities actually affect these target levels? Can you give us an indication of what these should be?
Yeah, definitely. The glycemic target is individualized. So it depends on the patient's age, duration of the disease, and as I said, the presence of comorbidities. These are the factors that decides the target values. So if the patient is young and newly detected diabetes, we tend to maintain a near normal glycemic value, that is blood sugar near normal range values, like fasting around 100 and postprandial 2 hours postprandial less than 140 milligram per deciliter. But when the patient is older, duration of the disease is more, we will be a bit relaxed. The fasting will maintain leave up to 125 and postprandial up to 180 milligram per deciliter, because these patients are at the risk of developing low blood sugar values, that is hypoglycemia. So to avoid that, we will be a bit lenient on glycemic target in older and longer duration of disease.
Right.
And regarding the comorbidities and the glycemic target, certain conditions like cardiac failure, kidney failure, and uncontrolled hypothyroidism, these are the comorbidities. When they present with the type 2 diabetes patient, it will induce hypoglycemia when we tend to maintain lower glycemic values. And in patients who has already having cardiac disease, if they develop low blood sugar values, they tend to have a newer heart attacks. So in this kind of patients who have a cardiac failure, kidney failure, and heart diseases, we tend to maintain a higher blood sugar value compared to a younger population who don't have any other comorbidities.
All right. Dr. Navasundi, does aspirin actually help in reducing heart attacks or strokes? Is it safe to take low-dose aspirins to prevent heart attacks for people who do have a higher sort of risk factor when it comes to this?
I think this is one of the drugs invented to reduce deaths. And when prescribed by a qualified person, it greatly reduces the risk of heart attack and paralytic strokes, provided, it's prescribed in a certain clinical scenarios. Should every individual take an aspirin? No. Because when there are no increased risks, if aspirin is given, there tends to be a slightly higher risk of bleeding, major bleeding. It could be in the stomach, it could be in the brain or anywhere else. But in those who have had previous heart attack or strokes or clots in the legs or anywhere, it greatly reduces the second chance of blockages in the pipes and heart attack and strokes. And also those patients who have never had a heart attack or stroke, but who have higher risk for having one, such as those with multiple risk factors, hypertension, diabetes, obesity, chronic kidney disease. When there are more the risk factors, more the benefit by using a small dose of aspirin. And this can be kept at home whenever there is a significant discomfort in the chest. It can be taken before you reach out to the medical fraternity.
But what about a diet, a heart-healthy diet, Dr. Navasundi? You know, are there foods that one should always have at hand in order to promote such a heart-healthy diet? And of course, you know, it's always simple to talk about what needs to be done, but, you know, between advice and actually people following it, there's usually a huge gap. So how does one get around that?
No, I think it is the conviction. The humanity needs to understand that even all animals have an instinct to survive and live long and not to suffer any disease. Right. But we tend to take this as an opportunity to indulge these diseases, diabetes, hypertension, heart disease, stroke, are all lifestyle-related diseases. If we manage our lifestyle, that includes diet, exercise, sleep, not taking stress, and being happy and calm, greatly reduce the chance of any major illnesses, including cancers. Coming to particularly the diet, I think it's very important to eat as naturally as possible. Consume a lot of fruits and vegetables, at least 2-3 servings a day, and eat things which are less in sugar, less in salt, less in oil, and eat complex carbohydrates such as whole grains like bajra, wheat, jowar, less of very easily assimilable foods, and avoid which has been preservative added foods, because they tend to have more salt and chemicals which tend to accelerate inflammation inside, increasing the chance of having either heart related or kidney or stroke related diseases in the future. The more those people who consume meat, I think restricting to lean meat, like, you know, the chicken from the breast pieces, or having fish, especially those ones which are oily, those would benefit more than eating full skin, full fat meat and eating lamb and other kind of red meats.
All right. Thank you very much indeed, Dr. Navasundi and Dr. Naveenkumar, for joining us on the show and setting the record straight on so many questions that people have in the management of these chronic conditions. Thank you. Thanks for watching.